iridocorneal endothelial syndrome. ICE syndrome affects one eye of a middle-aged woman. It consists of the following three clinical presentations. Number 1, Chandler syndrome. Number 2, progressive iris atrophy, also termed as essential iris atrophy. And third is iris nevus, also known as Cogan-Rees syndrome. Pathological basis in all three is abnormal corneal endothelial cell layer with a predilection for proliferation and migration across the anterior chamber angle and onto the surface of the iris, with subsequent progression to glaucoma in 50% cases, and corneal decompensation in a substantial proportion of involved eyes. Glaucoma is due to trabecular obstruction by proliferating tissue followed by angle closure secondary to contraction. Polymerase chain reaction testing shows the presence of herpes simplex virus DNA in a substantial percentage of ICE syndrome corneal specimens, suggesting a possible viral etiology. Diagnosis: clear differentiation between the three presentations may be difficult. Apparent transition from one to another has been reported. Differentiation depends primarily on iris appearance, but there is often substantial overlap. Gonioscopically visible changes in some patients may be subtle, despite elevated IOP, particularly in the early disease. The specular microscopic appearance is characteristics. Number 1, Chandler syndrome. It is the most common clinical presentation and is characterized by abnormal corneal endothelial appearance said to resemble a hammered silver. Here you can see. It frequently presents with blurred vision and halos due to corneal edema, which you can see in this picture. Iris atrophy is absent in about 60%, and in the remainder is variable in severity. Keratoconus is mild to moderate when present. When glaucoma occurs, it is usually less severe than in the other two presentations. Second is progressive iris atrophy or essential iris atrophy. It is characterized by iris changes including keratoconus. Keratoconus is pupil malposition. Here you can see keratoconus or pupil malposition. So this is keratoconus, and there is iris atrophy in the early stage. This is iris atrophy in the early stage. And there is pseudopolychuria. Pseudopolychuria means supernumerary false pupil. Supernumerary false pupil and broad-based peripheral anterior synecdoche, then often extend anterior to the Schwalbe line. Severe iris atrophy occurs in the late stage and is associated with ectropion uvea and severe glaucoma. Third presentation is iris nevus or Cogan-Rees syndrome, characterized by either a diffuse nevus that covers the anterior iris or by iris nodules. Iris atrophy is absent in 50% of cases, and in the remainder it is usually mild to moderate, although keratoconus may be severe. The appearance may be mimicked by a diffuse iris melanoma. Treatment: the medical treatment of glaucoma is usually ineffective. Trabeculectomy with mitomycin C can be tried, but the long-term results are poor. glaucoma drainage device or cyclodiode laser may be required. Corneal treatment. Edema can be treated with topical hypertonic saline in early disease and transplantation later on. Prognosis. The long-term prognosis is poor.